Are you in your late 30s all the way to your 50s and you are wondering what specific anti-aging product that you should be focusing on or how much you should be spending on your skincare products? How about what particular product or service should I be focusing on? That's what we're going to be talking about today, to focus on the fine lines and wrinkles, uneven skin tone, maybe some a little bit sagging and extra dryness in your skin. Or how about some of you who are in your late 30s to 50s and instead of having the typical dry skin, scaly patches, uneven skin tone, now you're starting to see breakouts, oily patches, unbalanced skin. So stay tuned for the pro tips to find out what particular things that you can do for your skin, as well as make sure to click on the links below for descriptions and in our description box for product links. In our last video, when I was talking about what happens to the skin in your 30s and what best skincare products and regimen to focus on, in the 40s and 50s, formation rate, so the skin cell turnover rate, significantly starts to slow down, where you actually really start to see dull skin, more pronounced uneven skin tone and age spots that are happening. Now, the collagen and elastin continues to break down even further at this point. However, the difference is that most women in this stage will actually start to see an increase in pore size. So where you may have only seen it maybe around your nose, now you're seeing more on the forehead and around it spread down to the cheeks. And the reason why is because the collagen and elastin has begun to loosen. It's not as firm, and so the pore size, it appears to be larger because your skin starts to lack that suppleness and that plushness. And others of you, because of the decrease in estrogen, which stimulates collagen and elastin, you also will see an increase in oil production as well as some breakouts and, unfortunately, some of the facial hair that may start to appear. Hi, my name is Christy and I'm the owner of Go See Christy Beauty Boutique, and I'm a licensed esthetician, and I've been treating clients with hyperpigmentation, fine lines and wrinkles, and acne for over 10 years. And today we're going to be talking about your best anti-aging skincare regimen, as well as some products and things you need to focus on today in your 50s. Now, depending on the individual, this is actually the 40s and the 50s is actually where, very similar to puberty, is where the hormones really fluctuate. So sometimes your skin can feel really, really dry, and other times it can be oily and break out. And especially for those of you who are using a lot of exfoliating properties for anti-aging, you'll see even more dryness and flakiness and itchiness, and your skin may even become more sensitized to different products. So first off, let's start off with the cleansers. Most cleansers that are being sold today, the pH it's hovering around 10, a pH around 10, which can strip the acid mantle. Your skin likes to hover around a 5.5, which is the pH of your natural acid mantle. So one of the ways that you can tell is if you wash your face and without adding anything on your skin, if your skin starts to feel a little bit dry, or if you feel your skin and it doesn't feel slight slippery from the oil that you have on your skin, it may be because your cleanser is stripping that. One of the other ways that you can tell is if the foaming agents that they use are sulfate derived, it can be a little bit drying as well. So you want to look for things that have cocoa glucoside or a coconut-based surfactant. Plant-based surfactants will wash your face without stripping that acid mantle. So at this stage, between your 40s and your 50s, your estrogen levels really start to wane, and therefore your skin will really start to see some changes, especially in areas where you normally wouldn't. This would include your chest, maybe the inside of your arms, your knees, where you see a lot more crinkling. So this is where you need to focus on that may be a little bit different than people in their 20s and their 30s, and that is replacing the fats that restore the hydrolipid barrier. So this nourishes and protects the skin. So this is focusing on essential fatty acids that you need. So some examples are GLA, which is a gamma linoleic acid, oleic acid, hyaluronic acid, which is not a fatty acid, but it is a humectant, algae oil, sea buckthorn berry oil, squalene and omega-3 fatty acids, as well as grapeseed oil. So the irony of this life stage and the anti-aging beauty industry is that this is the life stage where we need an increase of the fatty acids, okay? So this includes fatty acids, cholesterol, and ceramides. But the anti-aging beauty industry is focusing on speeding up your skin cell turnover rate, increasing that desquamation rate, which in turn can really dry out your skin. And dehydration and inflammation are the key things that can superficially age your skin even faster. Okay, so here comes the pro tip, and the pro tip is using a toner that has these three things that it can do. One, increases the hydration ability of your skin. Two, to be able to retain the hydration properties in your skin. And three, reduce the amount of inflammation on your skin, especially if you're using a whole lot of anti-aging ingredients. And so I will put a link in the description below for this great toner. So in our life stage, and cotton-based toners were really big. And when I say cotton-based, it's the toner where you have to get a cotton ball and you take the toner and you put the toner onto the cotton ball and then you wipe your face with it. Now, the new generation of toner is I want you guys to start looking at spray toners because it does a couple of things. One is if it is a spray toner, not all the time, but usually if it's a spray toner, typically the formulation is to actually increase the hydration properties of your skin. You need less of the moisturizer because it's already creating that moisture barrier. When it is a cotton-based toner, typically the formulation is to strip your skin, to take off the additional makeup that you may have in your skin. It's more of a cleansing property and more astringent than a hydrating property. So if you're in your 40s and 50s, I know we all grew up with the cotton-based toner, but I want you to start focusing on the spray toners. So I'm always talking about getting a good quality serum, but in your 40s and 50s, it's still important. But now I also, in addition to that, invest in a very good cream. Now, it's not always true that the more expensive it is, the better it is. That's not always true. However, if the price seems too good to be true according to its claims, it probably is. So the first thing I want you to do is I want you to focus on creams that only come in a pump dispenser or airless pump, because if it does actually have the peptides and the antioxidant that it's claiming, when you open up that jar and you're sticking your fingers in it, you're oxidizing the entire product every time you're opening it. And two, you are sticking your fingers in it, and you have to remember, on our skin we naturally have some level of bacteria and yeast, so that means that they would have to have even more preservatives in there to keep the fungal, the mold, and the yeast from growing in the product. So let's just get that out of the way and try to focus on those airless pumps or even tubes. The main thing is that you're not exposing the entire product to air as well as your fingers, okay? So the one I want to talk about is the post-recovery cream. So for those of you who are using Retin A, retinol, you are doing microdermabrasion, you're doing acid peels, things that are going to inflame your skin to ultimately stimulate the fibroblasts to make new collagen and elastin, you have to bring down that inflammation, because inflammation, especially over a prolonged period of time, ages the skin or your organs or your joints. So you need things that calm your skin, reduce that inflammation, have a unique blend of fatty acids and cholesterol and ceramides in there, as well as humectant properties. So the first one I'm going to talk about is called the post-recovery cream. It is perfect if you've done Fraxel, if you're using Retin A, if you've done peels or microdermabrasions. And this doesn't have any petroleum, it doesn't have any occlusive agents then that can clog the skin. So what's unique about this one particular cream is that it does create a favorable pH for your skin to bring down that inflammation, for your skin to be able to start to heal and hold its own moisture. So here are some of the healing and humectant properties of this cream. Again, it has antioxidants, it has vitamin A, C, and E. It also has beta-glucan to soothe the skin. It has squalene, which is an incredible hydrating emollient derived from olives. And it also has glycerin and sodium PCA and aloe vera gel. And it also has evening primrose extract for those of you who love evening primrose. So the second one, now this is for those of you who are doing anti-aging, but you may not be doing such aggressive procedures, because this one is actually higher in the essential fatty acids. This is the MD Dermaceutical Overnight Repair Cream. And the third ingredient is vitamin C, and it is actually a vitamin C derivative, so it's not as irritating to the skin. And it's really effective in the anti-aging properties. The other one it has is organic aloe vera gel for humectant properties. It has sodium hyaluronate in there, and it has a very unique balance of the fatty acids, cholesterols, and ceramides that are derived from things such as the organic shea butter, jojoba oil. These are all very, very hydrating. It makes the skin smooth and it heals the skin. I do want to also point out that this unique derivative of the vitamin C is proven actually, and I'll put the link below of the case in there, where it's actually more effective on the acne than it was on clients who were using 5% benzoyl peroxide. So for those of you who are have mature skin, but you're still battling with acne, and the acne products over time are kind of sensitizing your skin, this may also help with that. And for those of you who are watching this for the first time, if you haven't seen my exfoliation, the 3 different types of exfoliation, and what is best for your skin, then please go ahead and click the link below to go ahead and watch that. Because if you haven't heard already, exfoliation is important to your skin at this life stage, because really the desquamation rate really starts to slow down. So that's one of the focus. But really in your 40s and 50s, even though that is important, your serums are important, really start to focus on the essential fatty acids that you need, because you start to need restoration in your ceramides, and those are your lipids that are in between the keratinocyte, which then increases your skin's ability to hold in that moisture. So you want to now start to focus on skincare products that protect, stimulate collagen and elastin production, as well as restore the collagen and elastin, because you're losing a lot of it, because the dropping levels of estrogen don't stimulate the collagen and elastin so much. So the ingredients you want to look for is vitamin A, marine collagen, growth factors, and alpha lipoic acids. The other one is anti-glycation ingredients, and if you don't know what anti-glycation is, then make sure you check out our video on how sugar ages your skin. So we're not going to get into that today, but the ingredients that you want to look for that is green tea, cinnamon, peptides, and amino acids. Now, for those of you who are hoping to find some hyperpigmentation things in here, there will be a hyperpigmentation series coming. So if you haven't subscribed, make sure you subscribe and hit that notification bell. And remember, makeup is an art and skincare is definitely a science. Thanks for watching.